It's time for Wave 3 Listens Live, taking your calls to hear what you have to say on Kentuckiana's first live local TV talk show, and hitting the streets to be live on location in your community. This is Wave 3 Listens Live.
And welcome to Wave 3 Listens Live, a drop-dead gorgeous day. Welcome to Wave 3 Listens. And you know, May, there are many exciting events that happen in the month of May. Of course, we have the Kentucky Derby, perhaps a graduation or two. But did you know that May is also the month for National Stroke Awareness? We certainly would like to educate you. That's what this show is all about. And we're open to your phone calls as well at 571-5263. From the University of Louisville Hospital, I have a couple of very special guests. You've seen him on this show before. Dr. Jignesh Shah. Dr. Shah is to my far left, and to my immediate left, this is nurse practitioner Betsy Wise. Betsy, welcome to the show.
Thank you.
Welcome back to the show.
Thank you.
See, I'm the new guy on the block. You guys have been here before, so we're the dynamic trio today. We're going to make it happen, right?
Let's do it.
All righty. Now, Dr. Shah, first to you. You currently are a medical resident,
Yes,
correct?
that's true.
I wanted to hear from you and also inform the folks the importance in your agenda and why it should be important to them as well about stroke. You will eventually specialize in stroke, and you are currently, right?
Well, I'm a medical resident with the neurology department right now, and I'm planning to do a stroke fellowship after I finish my residency, which is 1 year from now. So my current interest is in doing stroke for now.
Okay, and Betsy, University of Louisville Hospital, it's very important that you specialize. You'll have a very specialization. Everyone has a specialty. Yours in particular is on the stroke team as a nurse practitioner.
Yes, sir.
All right, tell me exactly how does your role enhance the stroke team?
Sure. We not only aid the physicians that are on the team, we take a very intricate part of helping to move that patient not only through the ER, through their hospitalization, but a big part of our role is the education of the patient and the family when they come in about what a stroke is and all the risk factors that we'll talk about today. So I see myself as a kind of a jack of all trades, if you will. I can see a patient like the residents do when they come in through the hospital, whether it's in the ER, we transfer them in from an outlying hospital, and then I can help with the care of that patient throughout their hospitalization and do some of the extra things with the family and the patient that they need to be better prepared when they go home.
All right, now since May is National Stroke Awareness Month, some statistics we want to throw at them, and these are frightening, but I did not know that stroke is the leading cause of death and also the leading cause of long-term disability. Dr. Shah, do you want to comment on that?
So stroke is the 4th leading cause of death in United States of America. It's one of the most leading cause for disability in adults because, as we know, if a patient gets a heart attack, he may be walking around the street, but they may not be able, nobody knows about it. But if a patient has a stroke, they can have like significant disability and everyone knows about it.
You know, my understanding of stroke is fairly basic, although thanks to you, I'm becoming more educated, thanks to both of you. But I've always considered it, it's like a heart attack of the brain.
Right.
Is that correct? And there are a couple of kinds of strokes here.
Absolutely.
And maybe both of you all can help me expand on that. Let's first of all, Dr. Shah, let's talk about the two kinds of stroke.
Sure. So stroke, basically, as you mentioned, is a heart attack of the brain. It's called a brain attack, if you want to say in a layman's term. And it is caused by blockage of the vessels, the blood supply which goes to the brain. And it can also be caused by if the blood vessel breaks, which will interrupt the blood supply to that part of the brain. And when that part of the brain does not get enough blood and oxygen, the patient can develop symptoms. So brain, every part has a different function to perform, and if that part of the brain is affected, that function will be lost. The most important symptoms which patient often notices is weakness on one side, numbness on one side, speech difficulty, or sudden onset of dizziness.
You know what's scary about this, Mrs. Wise, is I think that there can be very subtle symptoms, there can be very severe symptoms.
That's
so
right.
I think we should talk a little bit about, first of all, tell me about what you have seen. There are probably some folks who come into the ER and they're very confused. It's like, I'm feeling this, it seems to be okay, or I'm a little numb on this side of my face, I'm having trouble pronouncing my words. You tell me through your experience.
Well, and you're right, I've seen the whole spectrum of cases, and what's unfortunate are the folks that have had those slight symptoms in the past and have not paid attention to them because they've gone away. And we can talk more about what a TIA is. But so a lot of people, if they are not in pain or they're not completely disabled, they don't seek medical care. And that might be the slight numbness to the face, or the face and arm might have slight numbness for a minute, or even weakness, but 10 minutes later it's gone.
Well, here on the screen, we're putting some of these warning signs up and want to have you guys comment on these. Dr. Shah, what is the most common kind of stroke that you see?
So the most common type of stroke we usually see is the ischemic stroke. It accounts for about 80% of the strokes which happens. The rest of the 20% are the hemorrhagic type of strokes. And the patient can present very similarly, but patient needs to come to the hospital to seek medical attention so that we can treat those patients accordingly.
And Mrs. Wise, I think, it's very important the University of Louisville Hospital has state-of-the-art care, and certainly you do. How have you seen, in your short career, because you're a young lady, in your short career, how have you seen treatment evolve? Have you seen a lot of more state-of-the-art, have you seen better outcomes due to the fact that technology is definitely advanced?
I think not only technology, I think that by educating heavily the population as we're doing now, you have those people that are now recognizing stroke symptoms earlier. Heart attack has been recognizable for years. They've done a lot of push in education. I think that we've done a fairly good job, but still have our work cut out for us in the education part of that. Technology has been fun to watch, the advancements of technology. We are getting more precise to what the brain needs in technology. So back in the day, and Dr. Abou-Chebl or later may talk about this, we would try to use things for the brain that we would use in the heart. And the brain's a different animal, if you will. It's just a different part of the human body that it's not the heart. So we've seen we have standards of care, but we can go beyond that now and beyond the typical time window to help those patients out that might miss an opportunity to get the IVTPA, which is the classic standard of care.
Right over my head, just she keeps going right over. That's okay. I expected a little of this. Okay, but Dr. Shah, I see you smiling, both of you smiling. As a doctor, it has to be rewarding for you, as well as you as a nurse practitioner, to see the advancements, to know that when a patient comes in to University of Louisville Hospital, that the outcome could be better than it was 5 years ago, 10 years ago.
Absolutely, that's very true, because we are, as Betsy was mentioning, the technology is advancing, the neuroimaging is advancing, we have more ways to diagnose a stroke and also diagnose any similar presentation who does not have a stroke. The treatment is advancing. The treatment for now, the only FDA approved medication is the TPA, which can be given only up to first 3 hours after the onset of symptoms. And mind it, the symptoms has to be noticed at presentation. If a patient wakes up with some symptoms, it does not signify that the patient so we don't know when the symptoms started. So we should know exactly. The reason is if the medication is given beyond 3 hours, the chances of hemorrhage, the side effect of the medication, can increase. And that's why FDA has not yet approved the use of that medication beyond 3 hours.
All right, this fascinating topic, as we mentioned before, May is National Stroke Awareness Month. If you have a question, perhaps you're feeling some symptoms, or maybe your spouse, maybe a parent, give us a call, 571-5263. We can talk about this. Thank you very much, Mrs. Wise, Dr. Shah. We'll be back with them and your questions. On Wave 3 Listens, we have the experts from University of Louisville Hospital. Thank you so much for joining us. It's Tuesday, Wave 3 Listens. We're talking to the experts from University of Louisville Healthcare, University of Louisville Hospital. Taking your phone calls here. Before we get into those phone calls real quickly, and this may be a question direct to you, Betsy Wise, is okay, someone thinks they're having a stroke, they've read the symptoms, they say, I'm having a stroke, they call 911.
Right.
Where does it go from there? What is the process?
So 911 has been heavily, or the ambulance services have been very heavily educated in getting those patients to us, and they have actually been calling ahead to the hospital to let us know that they have an acute stroke en route to us. What happens then is the ER lets us know they have a phone number that they dial, and the whole stroke team goes and meets the patient when they come in through the ER.
That's impressive.
We know that the quicker we can assess them, get that first CAT scan, get a quick exam, then we know exactly how to take care of that patient very, very quickly. In stroke, seconds mean all the difference in the world.
So, much like a heart attack, right?
Yes, absolutely. So I want to reiterate this. Patient, given as you mentioned earlier, that stroke is painless. So patient often ignores those symptoms, and patient may not call 911 immediately. So I want to tell the patients over here that you need to call 911 if you develop any symptom the first. Don't call your family first call 911 before calling your family, and then come immediately to seek a medical attention, and we will decide if you have stroke or not. And if you don't have stroke, we will not give you the medication. But if you do have stroke, we don't want to miss those initial few minutes to hours.
This is fascinating. I have so many questions for you, but I'm going to let our viewers give a few in here. So we'll intersperse my questions with their questions. Let's go to Melissa, who has been patiently waiting. She's calling from Columbia. Melissa, welcome to the show.
Hello?
Yes, go ahead, Melissa. Go ahead.
Yes, I was wondering, I had took a fall in a store, and it was the most unusual because I was, one second I was standing there, the next thing I woke up, I was in Louisville Hospital. And, well, actually, they had woke me up for a few minutes in my hometown hospital, but I went right back out, and I woke up there. And after I woke up there, I noticed my whole right side of my face was numb. I couldn't use it. I couldn't feel it. And my right side of my mouth, I couldn't. I would try to drink something, and it would go in the left side and come right back out or go in one side and come out the other. And I was wondering, they hadn't told me that I had a stroke. And I was wondering if I had to go to the emergency room a couple of days ago, and they said that they told them I had had a stroke. I was wondering why they hadn't, discussed any of that with me. And what does that mean? What does the numbness in the right side of my face mean?
Well, so thank you for calling, first of all. The reason for you having right-sided numbness in the face, there could be multiple reasons, but and that's why we say that patient needs to come to the emergency room. There could be other reasons why patient can have those kind of symptoms, like patient can have low glucose, which can sometimes cause this kind of symptom. Patient can have decreased blood pressure, which can cause sometimes this kind of symptom, and patient could have seizures, which the patient don't even know about it and develop this kind of symptoms. But the most important thing is to rule out if the patient has any stroke. So we don't know if, Melissa, you had any stroke or not. I don't know about it, but it needs to be medically evaluated if you get any such sudden onset of this kind of symptoms.
Okay. And Betsy, I wanted to ask you, when you initially meet a patient in the emergency room, obviously